My name is Maka. I'm a Global Fund TB program manager in Georgia. And it's so nice to see all of you, to meet all of you. And I think that you are all those people who work on a daily basis on these issues. And we develop the monitoring plans, we implement them, we work with strategies. So these are issues that we encounter in our daily lives. But I think it is sometimes very useful to go back to theoretical basics that, yes, which are the foundation of our work. We all know those theories, but sometimes they change, and we have already seen that some of the principles and strategies have changed because new knowledge has come, new understanding has come that TB does not get into the frames of medical model. There are social determinants and other issues that are related to management, to human factor, and we have to take them all into account. Also, definitions have changed because the practice has changed. The methods, the diagnostic methods, treatment methods have changed. And this whole thing, of course, influences our daily life. As to the presentation itself, I will have to shift to English because I will stumble terms, but you can ask questions in any of the languages and whenever it is convenient for you, and the more questions you ask, the better. So let's start.
Have you heard of this, and how many of you are familiar with root cause analysis? I believe you are, actually. Because one of the methods which we will be discussing today will be 5 whys. And a day before yesterday, Ukraine said when something is wrong, we're asking why. So we are doing that in our daily practice, but what is underlying theory for that? Root cause analysis, by definition, is a process of discovering root causes of problem in order to identify appropriate solutions. As a person with a medical background, I would like to compare it with diagnostics. So we have patient with symptoms, and for instance, the patient is running temperature. So we can give aspirin or Panadol and lowers the temperature, but the next day the problem will be the same. So we need to identify why this patient has a temperature. If it is TB, then we have to assign treatment for TB. If it is flu, then treatment will be absolutely different, and we cannot substitute one with another. The same is absolutely root cause analysis for management practice. So we shall not treat the symptoms. Well, sometimes we need to treat symptoms ad hoc because it is urgent and it is also needed, but it is much more effective to identify the real causes of the problem and treat them rather than symptoms. The root cause analysis as a term is an umbrella term. It covers a wide range of tools, approaches. I have given here a list of different ones. And of course, this list is not exhaustive. Today, we will be talking about the first two. It is 5 whys and fishbone diagram. These two were selected as the most simple and most universal. I mean universal that the others necessarily require numerical values, while 5 whys and fishbone we may use with numerical data and also with qualitative information. So it is less restrictive, requires less statistics, may be used at different levels, and is not that sophisticated. In difference with this, let's say Pareto chart is a chart. It is a combined chart with bar chart and line chart altogether. So we will need definite 2 sets of data. The same with scatter diagram. So let's go to 5 whys. To look at a glance, it is a method that uses a series of questions to drill into the layer of a problem. And we will be asking why 5 times. This is a method that comes from the industry. It was designed by Toyota, the well-known champion of quality improvement initiatives, and then used by different industries and also used in healthcare. So this is simple tool once again, but also we should remember that this is not suitable for complex problems. So we have to be very careful with healthcare. So at a glance, it is simple, as I mentioned, it is cost effective. It may be done by one person, but usually it is better to be done by a team. It helps to determine root cause quite easily. The process is fast, maybe fast, and it is still a structured approach, so it will help us not to miss something important. And it is very good for operational problems, and I will demonstrate that with my own example. So as it came from the industry, it has usually 2 applications. The first, it may be used to identify why something happened. So why was this error made, or why was something not made? And there is a whole set of different questions to identify why our monitoring system did not detect it. So why made and why not detected? We can use this approach for both of them. These are the very easy steps to use the tool. So first of all, as I said, if we use the team approach, we have to create a team. This team should be composed of people who are well aware of the problem, who know the system, who know what is happening. It is useful to observe what is going in the system, if it is possible. If no, then people have to share their views, to show their knowledge, their experience, and they should be team members. Then the next very important step for 5 whys and for any root cause analysis is definition of the problem. The problem should be, in best case, 1 sentence, very specific. What is our problem? If we describe everything around, it will be not good. 1 sentence, precise problem. If it is time-bound, better. If it is, it has some measurable items, also better. So then we are starting to ask questions, and I will go into more details of that. So usually, why 5 whys? So it is not any science behind those 5 whys, just a rule of thumb that usually those 5 questions are enough to get into the root cause. It might be 2, 3, 7, depends on the question. If it is complicated, it's also experience of the team. If we feel that 3 questions are enough, that is enough. If 5 are not enough, then we're going to the others. So for all questions in those 5 whys, we need to ask exactly the problem. So if we said that parts were labeled incorrectly, the question is why the parts were labeled incorrectly. Then depending on the answer, if the answer is the data set is unreliable, then we ask why the data set was unreliable. So we are asking the response that leads to the next why. We're also always asking the previous one. And it should, if we then go to the last question, we can check ourselves by saying something happened and therefore something and therefore something, and it should lead us to the first one. And if it is cohesive, then our logic is correct. If it is not, and if it is fragmented, then we might miss something. So the problem statement, I will not go into more details of it, but it is again, very important for any of root cause analysis. If we stated problem correctly, then it is half objective also achieved. The first why. So usually it is a little bit different. When we start doing this, it should be the first one intuitive. It might look that it is obvious, and quite often it is obvious, but it may happen that not obvious to everyone. And especially if it is the first attempt to do 5 whys, people usually start trying to justify themselves. So it is not the way, and it is not the place to justify. So you are asking something is wrong and why. And then you receive different responses that people are trying to say it is not because of us, it is because of something else. And the whole 5 whys is not because to identify who has done something wrong. So we shall be very cautious at this stage to have, I'm sorry. So to have right directions. So we need to try and to start to explain why something has happened, and avoid something not to frighten people that it is not to blame and shame. It is just to identify the root cause. And this is very first question which has to do with this. Next question, usually is more technical. So at this stage, there might appear that different root causes are suggested, and we shall focus on the one that is most probable and most important and had the most to contribute to the problem. The third one, it is considered really crucial for the successful transition between the things that are obvious and not so obvious. And here we need all our technical knowledge. It might happen that at this stage we are not able to continue immediately. We might need some data. We might ask that, yes, something, we have to make inquiry. We have to ask other people. We have to observe the process. But it is exactly the place when we should not rush into logical explanations, find more evidence that what we are thinking is exactly what it should be. So we go to the fourth why, and it is again, it requires candid approach. There might be different avenues to explore, and I will demonstrate those avenues with examples afterwards. So if they might be causes, but we can see that they are not root causes. So we have to continue with the one that is considered the root cause, and that will be important for improvement. And finally, we got to the fifth why, which shall lead us to the situation. And when we address this fifth cause, we should have a solution for our problem, find solution to our problem, and it will prevent the same problems from occurring in the next time. So this is the most important part of 5 whys. We shall identify the cause in order to prevent future happenings and to avoid waste of time and money. So in conclusion, this is a very simple way. So maybe I have talked a little bit long about it, but still, if we have a group of qualified people who are well aware of the situation, not only the problem, but system in general, then we have the opportunity to identify the problem and check it if we identified it correctly, and then try to find solution. And about solutions, we will be talking later in the afternoon. These are different ways to present visually our 5 whys. It depends on the taste. It does not have any special meaning. So different people, different teams like to present it in different ways. So if you look into the internet, there are lots of templates at your disposal. So it's again your taste. You use one of these approaches or draw your own. It is not restrictive. So it is quite flexible, but if you want to present it to someone, then it is good to have visual presentation. This is the one that I have chosen for myself. I like this one better. So this is the case, which is in many textbooks related to quality improvement. And this is, I would say, half real, half mythological case, because in some textbooks it is monument to George Washington, in others it is Lincoln. So, but the story behind is that the stone is deteriorating. You can see in blue that is on the top, we have a problem statement. We have a statue and the stone is deteriorating. So the first why is we have to ask why. Why the stone is deteriorating? And the answer is quite simple, because it is cleared intensely every 2 weeks. So the answer is it is cleared intensely. Then we have to ask why it is cleared intensely. And then the answer is because every 2 weeks it is covered with bird droppings. Then here is the third question. Why? Please pay attention. I have avoided. Ideally, the question would be, why is it covered with bird droppings? But the answer I considered was too obvious. So I asked directly why there are so many birds around the monument. And the answer is because there is a lot of food for birds. There are a lot of spiders. Why are there so many spiders in the monument? Because they are eating insects that fly around the monument. Why are so many insects around the monument? The insects are attracted by the spotlights that are turned on in the evening to illuminate the monument at night. So it is, and it is true that those monuments are illuminated. And it happened so that this one was illuminated a little bit earlier than others around, so these insects were attracted by the light. Well, obvious solution is to illuminate it for, let's say, 1 hour or 2 hours later than before. The textbook said this solved the problem, but again, it is half real, half mythological case. I fail to identify which is really. So, but it is kind of classical example of 5 whys. Now let's go to the case which is related to healthcare and which is my case personally. Well, actually not only me, it was, we had a team. I could say we did not formally document that we created a team or something like that, but we were really a team. I will start with the problem. So we have, as a Global Fund project, we have an indicator, % of TB patients with documented HIV status. Probably you also have such indicator as a program. So a Global Fund had invested and supported this initiative, and for years we had significant progress. The figure was above 90%, 92, 93%. And all of a sudden, in 2019, I found out that my indicator went down below the 90%. So of course, I had to ask why. And for that, I got into contact with Nino, Marina, Mamuka, exactly the people that are all here. So to identify what happened with our indicator, has the practice changed? No, the answer was no, the practice did not change. Actually, we are documenting, we're testing people and we're documenting, and I receive reports, monthly reports that say that these people are tested for HIV. Then why, how come that in country portfolio, the indicator went down? So my question is, why did the % of TB patients with documented HIV status decreased? And the answer was, reporting forms were incomplete. So recording was all right, but reporting forms were incomplete. And why the reporting forms were incomplete? Just a minor comment about that. The reporting forms were corrected, but it was done much later. And for Global Fund, where is your reporting time? February? No. Our PUDR is February. So by February, the data were not correct. And so when we checked the recording was there, but reporting was not. The reporting forms were incomplete. And why then, question, why were the reporting forms incomplete? They used to be, and then what happened? The testing practice changed, and there was a delay in reporting. Now, what happened? While there was delay in reporting, the staff had no motivation to timely transfer recorded data to reporting forms. So what really changed in practice was that National TB Center started testing people not with documented TB, but every presumptive case. So they had a long list of people who were tested for HIV, and out of probably 100, they had 5 to 10 who then later was confirmed with TB. So somebody had to check that the person with confirmed TB also was tested for HIV and had documented status. And that took a longer time than previously. So then we asked, why did the staff have no motivation? Because they did not receive clear instructions. And this was very key for solution. We need to instruct staff when it was time to explain them that everything they report after February is too late for the Global Fund project. So this reporting time frame should be kept. This is a case from which I borrowed from NHS practice. Also, it is healthcare related. And why have I selected this? Because this is exactly the case which more demonstrates the limitations of the method, which I want to underline. So here we have a problem statement that said patient received the wrong medication. Have you seen such incidents in your practice when patients receive wrong medication? No?
With the dosages, it can be.
Yes. I also have seen it long ago. We had the drug we were using called the euphyllin. It was in 2 dosages for intramuscular and intravenous use. And I have seen the intramuscular one administered intravenously, which is 10 times the dose of. But if we look at the medical errors, there are a lot of cases when patients receive wrong drugs. Just you have, let's say, the ward with 20 patients, and the nurse might give not that patient the drug, especially at hospital level. So in emergency situations. And here is the case exactly when the patient received the wrong medication. So according to our 5 whys tool, we have to ask, why did the patient receive the wrong medication? And the answer is the nurse did not complete patient identification. Well, actually, it might be not that much problem in such a case, but if you look into the literature, you can see that there are cases when people have wrong surgery. So patient identification is one of the very important. So you can find cases when wrong leg was amputated. So patient identification is one of very important points in patient care. The nurse did not complete the patient identification. That is, of course, a very significant issue. Then we ask, why did the nurse not complete patient identification? Because the patient did not have a wristband. Well, in Georgia, we do not have that wristbands, actually, only in maternity house, probably, with babies, but in some healthcare settings, they use wristbands. Why did the patient not have a wristband? The wristband has been removed and therefore the procedure and not replaced. So the next question is, why was the wristband not replaced? The printer for the wristbands was not working. and why the printer was not working. The staff needed to support IT has been reduced and was overloaded. So we came that here the root cause of all this was IT staff, support staff that was not available for this case. So this shows us, I will say the first and then go on with this example. 5 whys main limitation is that it tends to oversimplify the things because it came from manufacturing, and healthcare is much more complex than manufacturing. Yes, if we have, let's say, some parts made of iron, we do the same thing 100 times, 99 times, we will have the same results. It is not in healthcare. In healthcare, there are too many people, too much of human factor, too much complexity. People do not respond the same way like iron. So we have to be aware that oversimplification is kind of dangerous. And second one is still the method is very subjective. Also, we're a team, we have to agree on some things. The method is subjective. It is outcome of brainstorming. So we can have a different team which might suggest something different, and with the same success they will come with different root cause, which is also valid because there is no one but might be several causes. So with the same case where the patient received the wrong medication, we could start and answer the initial questions, initial whys, with the same pace, with the same answer. So the nurse did not complete patient identification. But why did she not complete? Because the patient did not have a wristband. Again, up to here, it is all the same. Why did not identify why did not patient have a wristband? Because printer was not working and white was not working. And here, instead of IT staff, it might be the case when the poor quality printer was procured. Why? Because this is equipment that is non-clinical, so it was not seen as important for safety. So with the same logic, we appeared with completely different root cause. So in one case, it was human factor. In another case, in the same case, it was equipment. In real life situation, usually it is both of them, and even many more. If we look at this case, it is exactly, I don't know if it is seen, but it is exactly the case of a wrong patient identification because of wristband, and all of them, we just followed the one that goes up and up, but all others are also valid. So eventually, instead of one line, 5 whys, we might end up with a lot of such things. And because of that, I will, in the next session, I will move to the fishbone analysis, which is more close to real life situations because the real life situation is not that simple as just 5 whys. Now going back to our root cause analysis tools, and this is fishbone, so-called fishbone. It is called fishbone because just it looks like a fish. By definition, it is a way to sort possible causes into categories that branch off from the original problem of interest. This is usually a schematic presentation. It gives good visual understanding, and besides, this is more, I think, at least more appropriate for healthcare settings because it enables to identify multiple causes. And there are cases when fishbone and 5 whys are combined and used at the same time, and I will show you how it is done. So what is the benefits? Again, it determines the root cause of a problem. It encourages group participation. Ezra has spoken about this. It is very important to have a team, for the team to have a common understanding of the problem and to have a good composition of the team. And because we have to use the graph knowledge, and it also will help to increase our knowledge and understanding of the system and of the challenges. It is easy to apply and can be used for a range of problems. It is as both root cause analysis in terms of is it fishbone or 5 whys or Pareto chart or any of them, they are considered to be integral part of continuous improvement. So we identify problems, solve the problems, and that leads us to continuous improvement. But here, let me give one citation, which I read in the Harvard Business Review. It said that many improvement programs have the same effect on performance as rain dance has on weather. So if we don't want to be involved in rain dance and wasting our resources, our time, we better find out what is the root cause of the problem. What are the steps? There are 6 steps generally in a fishbone diagram. First of all, we create a team, and I will not focus on team again because it was already presented and overviewed. Again, these are people with different backgrounds, but knowledge of the situation, knowledge of the system that can contribute to common understanding. Then we have to define the problem, and there is no difference with the 5 whys. But what is different, we write it, it is the visual presentation. We write it as a head of a fish. So it is, you can see in this sample case, it is newspaper delivered late on Sundays. So why there? Why you probably noticed the fish was looking to the right side. Again, it comes from Japanese manufacturing, the method. So they write in columns which move from right to left. So they have drawn the fish from right to left. We can do the same, or we can move the fish. It is up to us. It doesn't make sense. So it has no specific meaning. So we have the problem statement, newspaper delivered late on Sundays. We do it, it is head of our fish. So, and all team members have to agree that this is a problem. And it is good to be specific. Now, in this case, it is identified, it is on Sundays, not on every day. If we have numbers to add, like with indicators, percent or something, it is good to add here. So then we have to identify the categories. The categories are the areas you see above the arrows. The arrows here are considered to be the ribs of the fish. So here we have 7 categories, which is customer, process, incentives, people, supplies, environment, and budget. So it comes usually from brainstorming. It is upon us to define those categories. Also, there are some common categories which you can meet in the literature. They often are named as 4Ms, 6Ms, 8Ms, 4S. It is just for the conventional use. 4Ms are man, material, method, medicine, machine. But we can call it as we want. Not have special meaning. Man may be manpower, people, labor. It depends on our industry, of our understanding. I personally prefer to use people, because in healthcare, people are patients, healthcare providers, other stakeholders, funding agencies, regulators, etc. So it's more comprehensive terminology. Method, here you can find articles which use procedures, rules, common practice, but it is how the process is performed and specific requirements for doing it. And this is the first one, people. And as you can see, then there are 2 options actually. We can choose one, brainstorm on possible causes, and then assign them to different categories. Or we can choose first categories and then think of contributing factors. In this case, the problem is newspaper delivered late on Sundays, and the category is people. So what is wrong with people? We then write small arrows that go to ribs and 3 challenges identified: staff shortage, a lack of skills, and burnaround. So in some cases, people use at this stage 5 whys approach and go back and back. So lack of skills and why lack of skills, and answer and answer and answer until they go to the root cause. So in this case, I have shown one of them. It is burnout. So the burnout itself had 2 causes. It was workload and management issues. So in visual presentations like 5 whys, there are lots and lots of templates in the internet which you can use. It is up to your choice. But usually this presentation also doesn't make much sense. It is just simple. In real practice, people use something like this. We have problem statement and then the ribs and causes and contributing factors to that. If this is real case from healthcare setting, and in this case, some authors also advise to make statement as a question. Do not write problem statement, but from the very beginning, say why. So why the patient no-shows up 34% year over year. So it happened in a clinic that the story behind this is that clinic introduced new software that was sending reminders to patients. And because they had this new software, the people at front desk were advised not to make calls. I don't know if you have this practice. In private clinics, it is quite common in Georgia. You have appointment, somebody calls you from the clinic. You have appointment with this doctor, are you coming? So private clinics usually practice this because they value the time of that physician. If you are not coming, somebody else might come. And because they introduced the new software that was supposed to automatically generate messages and send them to the calendar, the front desk people were not calling anymore. And the outcome of this was that no-shows were up during year significantly by 34%. So the clinic started the process to identify root causes, why the rate of show-ups deteriorated. So they selected 4 categories: technology, procedures, patients, and people. People in this case are health service providers, both medical personnel and non-medical. So as you can see, the brainstorming led to many concerns related to technology. Also concern about the skills of people because training was very short, incomplete, and the people might not understand exactly what to do and how the technology worked. I would also pay attention that on the issue identified that patients were not using a calendar. So if you have seen those reminders, like Alexander is a fan of those new technologies and software, as soon as we have agreed meeting, my iPhone has a pop-up from the calendar, there is a meeting. But if I don't use smartphone, and which I believe many patients don't use, and it was case in this clinic that patients were not using calendar. So there was a message to the calendar, and there was no call, which would be more convenient for them. So it was, and this why this is a good example, because there are several factors identified by the fishbone diagram. We have to act on those which preferably can we do immediately, which is not that difficult, does not require much time and resources. And besides, we should leave alone things that we cannot influence. Like patients not using calendar, there is nothing we can do about it. It makes no sense if we start educating population on calendar use. So the outcome here of this exercise was they decided to, again, call the patients, just make phone calls because it is convenient, it is acceptable. And this is what we have to use until there was second part of it, until we find out how we can improve use of technology. This is second case which I want to present. It is also from healthcare. Actually, I adapted it a little bit for the LTBI screening. LTBI screening completion rates are quite challenging in many countries. And here I identified 4 areas: environment, procedures, people, and equipment. Well, actually, the original case was not LTBI. It was absolutely different. It was pap smear screening. So it is kind of more of different kind of things. But it was quite clear that the main categories in this case were the same. This is environment, procedures, people, and equipment. And we put this, our problem, low LTBI screening completion rates, at the head of the fish. And I presented here, just for the sake of space, one of them, just environment. As you can see, there are 4 contributing factors in environment. It is time, it is long wait time, it is space. And what I wanted to emphasize, you might see that some factors may be assigned to different groups. So if we have, let's say, time, and there is limited time for LTBI, it is a matter of environment, and it is at the same time might be a matter of people, because people are overloaded. And it is up to us to choose where we place the same things. Sometimes they might appear in different places, but usually it is better to design where you we place this one category and then follow that route. In this real case, if we fill out all the forms, just I wanted to show what happens after this. As you can see, a lot of these 4 groups, and then many factors that have to be taken into account. And there is a critical step after this, and all this is outcome of brainstorming. So here comes critical moment when we have to prioritize which ones we can select and influence, which ones are beyond our competition, our competence, which are beyond our authority, for which we do not have resources, etc. So what to choose from this variety of factors for our problem solving. And this leads us to the limitations of fishbone diagram. It itself does not help to prioritize causes. Selection of priorities is upon us. It will help us to present these causes in a systematic way, to identify a lot of factors, not to miss them, like there was oversimplification risks with 5 whys. Here we can present all of them, have a map, but then how to prioritize, it is upon us. And this maybe different technique will require something else to be done. Again, like 5 whys, fishbone diagram is subjective. It is output of brainstorming. Different team might come with different scenario. And because there are so many causes, we might need to spend time, too much time discussing those causes, and that might be misleading also.